one of the key areas that AORTIC has been looking at in the last 2 years is to develop comprehensive cancer centers in Sub-Saharan Africa. We do realize that cancer care can only be effective in a robust, comprehensive cancer center. And most of these are lacking. And one of the key things is to develop capacity. We have started engaging researchers and scientists across Sub-Saharan Africa for mentorship from countries in the United States, in Europe, and in many other, and in India as well. So one of the key things that we need to do is to develop capacity, develop infrastructures, and engage the ministries across ministries of health across Sub-Saharan Africa. We've had a meeting with AFCON, and we want to take this agenda to the African Union. The African Union Ministerial Committee on Health will look at some of the key points that we have raised to see how each and every country will develop at least one cancer center. The idea of comprehensive center, it is very apt at this point that many countries are actually developing not only capacity but infrastructure. You realize that 22 of the 54 African countries have no radiotherapy machines, but that is quickly changing with our advocacy. It's quickly changing, and a lot of these African countries are showing interest in developing infrastructure as well as developing national cancer control programs. We have also keyed in the African Cancer Coalition, which is a body that has developed guidelines for Sub-Saharan Africa. Because if you don't have a guideline, you are not likely to go forward. So the guideline is basically looking at clinicians to take, a standard of care to the wards, to the clinics. So the guideline basically has been tailored to be used as a best for treatment of cancer patients in Sub-Saharan Africa. So in all, the African Cancer Coalition has developed about 84 guidelines with the help of the American Cancer Society and the National Comprehensive Cancer Network of the United States, the NCC. And we are reaching out to ministries of health across Sub-Saharan Africa to adopt and integrate those guidelines. The guidelines are tailored, like I mentioned, towards treating cancer patients in Sub-Saharan Africa, considering the kind of infrastructures and resources that are available to the clinicians. You will find that when you use the guidelines, it will also create a kind of harmonization of treatment across Sub-Saharan Africa. And by so doing, we will be able to strengthen our referral processes. And already many countries have adopted the guideline, namely Nigeria, Kenya, Uganda, Tanzania, Rwanda, Malawi, and so on and so forth. So we will continue to do advocacy for that, and that will give way to understanding what comprehensive cancer care is all about. And once we have the clinicians ready to develop those to use those guidelines, then the next thing is for them to convince their policymakers to pursue even new infrastructures as PET-CT and the lack of it. So the comprehensive cancer network is working, and it is something that AORTIC is at the forefront, and AORTIC will continue to make sure that Africans have developed comprehensive cancer network, and that is the way that we can bring out a better outcome for our cancer patients. Thank you.